How do osteoclasts and osteoblasts affect secondary bone cancer? Imagine your bones as a busy construction site with workers constantly remodeling the structure. Two main types of workers are osteoclasts and osteoblasts. Osteoclasts are like demolition crews. They break down old or damaged bone tissue. Osteoblasts are the builders. They create new bone. In healthy bones, these two work together to keep the bones strong and balanced. But when cancer spreads to the bones, this balance gets disrupted, and these cells play a big role in how the cancer develops and progresses. Secondary bone cancer, also called bone metastasis, happens when cancer cells from other parts of the body, like the breast or prostate, travel through the bloodstream and settle in the bones. Once there, they interact with osteoclasts and osteoblasts, changing how these cells behave. This interaction can either lead to bone destruction or abnormal bone growth, depending on the type of cancer and how it influences these cells. Osteoclasts are especially important in osteolytic lesions, where bones are broken down more than they are built up. Cancer cells can produce signals that tell osteoclasts to become more active. For example, they releases substances like parathyroid hormone-related protein, which increases the production of rankle on osteoblasts. Rankle then binds to rank on osteoclast precursors, encouraging them to mature into active osteoclasts. This process causes increased bone breakdown, releasing minerals like calcium and growth factors stored in the bone. These released growth factors can then stimulate the cancer cells to grow even more, creating a vicious cycle that worsens bone destruction. On the other hand, some cancers like prostate cancer tend to cause osteoblastic lesions, where there is abnormal new bone formation. Here, cancer cells stimulate osteoblasts to produce excess bone, leading to dense, often brittle, abnormal bone tissue. Even in these cases, there can be some bone destruction because bone remodeling is a dynamic process involving both osteoclasts and osteoblasts. The cancer cells manipulate these cells to create a microenvironment that favors tumor growth and bone changes. The interaction between tumor cells, osteoclasts, and osteoblasts is complex. Tumor cells produce factors that influence both types of bone cells, altering their activity. For example, they can increase osteoclast activity to break down bone and releases growth factors that further support tumor growth. This cycle makes the cancer more aggressive and can cause symptoms like pain, fractures, and bone weakness. Understanding how osteoclasts and osteoblasts work in secondary bone cancer has led to treatments that target these cells. For instance, drugs like denosumab are used to block rankle, reducing osteoclast activity and slowing bone destruction. This helps manage symptoms and can prevent fractures. Researchers continue to study these interactions to develop new therapies that could interrupt this cycle and improve outcomes for people with bone metastases. In summary, osteoclasts and osteoblasts are key players in how secondary bone cancer develops and progresses. They can either promote bone destruction or abnormal growth, depending on how cancer cells influence them. By understanding these processes, doctors can better target treatments to help manage bone metastases. Always remember, if you or someone you know is dealing with bone cancer, consulting healthcare professionals is essential for personalized care and the most effective treatment options.